Thank you, Meg. Hello, my name is Andrea Lefebvre, UBA Director of Education and Compliance. On behalf of United Benefit Advisors and Fisher Phillips, I welcome you to today's presentation in the UBA Compliance webinar series. Today's topic is understanding the end of the COVID-19 public health emergency. Our speaker today is Jenny Kiesewetter. Jenny has more than 22 years of experience advising businesses in ERISA, employee benefits, compensation, fiduciary responsibility, and compliance matters. As a member of the Fisher Phillips Employee Benefits and Tax Practice in Nashville, she advises clients on all aspects of employee benefits and executive compensation, including qualified and non-qualified retirement plans, health and welfare benefit plans, cafeteria plans, severance plans, and equity-based compensation plans. Jenny, the floor is yours.
Thank you so much, Andrea, and welcome to everyone. I thought I would just click through a couple of these initial slides from UBA. This sentence under the welcome has never been more true than the past 3 years that employee benefits laws change rapidly. Here's both me and Andrea. This slide also denotes that employment and benefits law compliance depends on multiple factors. That's also very true, as everyone knows on this call. A lot of this is very facts and circumstances based, and it also depends on what the plan documents say, as the plan documents always govern. So today we are going to talk about the end of the COVID-19 public health emergency. This has created a lot of work for us in the industry for good reason, to help people get the coverage they need and the services they need during the global pandemic. But now is where I guess we can say we're emerging from it. We've got some new guidance that has just recently come out about the COVID-19 public health emergency, and we're going to explore what that is today. So our agenda, we're going to look at what does the end of the public health emergency mean for both employers and group health plans. We're going to gain some insight into some of the private insurance coverage flexibilities that will expire coming up here on May 11th, 2023. How that impacts deadlines to request internal and external appeals for adverse benefit determinations, timeframes for filing claims under the plan's claims processing procedures. And additionally, we're going to look at how will group health plans cover COVID-19 testing related services and vaccines moving forward, and how will this impact other welfare-based laws such as COBRA and HIPAA. So as we jump in, I want to take a quick look back so we can look forward and talk a little bit about the evolution of this law over the past several years. So we have the Families First Coronavirus Response Act, the FFCRA, which generally requires that group health plans, including fully insured, self-insured, and level funded plans, plus health insurance issuers, to provide benefits for items and services related to the testing and diagnosis of COVID-19 as of March 18th, 2020, and through the end of the public health emergency period declared by the Department of Health and Human Services. So if everyone remembers, 3 years ago this week, the country started shutting down with the virus, and this legislation was put into play fairly quickly to go back and grab some of those initial dates in March 2020, in the early days of the pandemic. Specifically, this coverage, employers, health plans, insurers had to amend documents to say that this coverage must be provided without any cost sharing requirements, including deductibles, co-payments, and co-insurance, without prior authorization, and any other medical management techniques, which we're going to dig into a little bit more in this seminar. Additionally, through the end of the plan year that begins before the end of the public health emergency, which we're going to get into exactly what does that mean, because Congress tends to put some of these complications in start and end times. But we're going to look also, the act allowed large employers to offer telehealth services to employees who are not eligible for any other employer-sponsored health group plan. So without being subject to any certain federal laws regulating group health plans. So the purpose behind this telehealth offering initially was that since everything was closed down, the government wanted to make sure people could have access to different health and medical services, even if they were not eligible for the group plan. Along with the FFCRA, we also have the Coronavirus Aid, Relief, and Economic Security Act, which we know is called the CARES Act. It amended the FFCRA to include a broader range of items and services that must be covered, including coverage for approved COVID-19 vaccinations. Just as a side note, we are still dealing with amendments to plans, revisions to plans for the CARES Act. The government has continued to kind of push out when plans actually need to be amended for the CARES Act. So we're still dealing with some of these initial COVID provisions, making sure the plans have the appropriate language when they were operating under these provisions. But the CARES Act, coverage for the COVID-19 vaccine must be provided by non-grandfathered group health plans without cost sharing, regardless of whether the vaccine is administered by an in or an out of network provider. So again, this was in the effort to get all COVID-19 vaccinations covered, no matter who provided them. Once the public health emergency ends, the COVID-19 preventative services coverage mandate will continue to apply, but only on an in-network basis. So we'll drop the out-of-network provider basis for vaccinations. So group health plan impact. It was a big impact across the industry, but with group health plans, the public health emergency is still effective. It's still effective today. Group health plans must continue to provide coverage related to the testing, including certain over-the-counter tests, which we now have for testing for the virus, and diagnosis of COVID-19 without cost-sharing requirements. Similarly, coverage for the COVID-19 vaccination must still be provided by non-grandfathered group health plans without cost sharing for still both in and out of network providers. So it's important, and we are going to address this in this presentation. There is a distinction between the public health emergency, which provides COVID-19 services, from the national emergency, which essentially has provided an extension of certain deadlines impacting group health plans, such as ERISA disclosures, COBRA deadlines, and other health plan administration. So we are going to talk a little bit as well about the national emergency because we got guidance on both of them at the same time. So we are going to look at both during this presentation. So let's look at some of these extensions. Clearly, I think, looking back, we can understand why we had these extensions. I don't think any of us 3 years ago thought that the pandemic would last as long as it did. But we did have the first extension in October of 2022. This was for the public health emergency, the coverage for anything COVID-19 related. It was extended initially through January 11th, 2023 by HHS. And then a second extension on January 11th, 2023, when the first extension was supposed to end or it was extended through January 11th for the first extension. Then on January 11th, they decided we're still not through this enough. We're going to extend the public health emergency once again through April 11th, 2023. And again, the public health emergency is the COVID-19 coverage. And then just recently on January 30th, 2023, the Biden administration released a statement of administration policy. And it was the extension of both the public health emergency and the national emergency. And that got pushed out to May 11th, 2023. So the end of these, they called them in this notice, that in this statement that the administration released, they called both of these the declarations to extend the public health emergency and the national emergency. Once these end, May 11th, 2023, it will trigger the end of certain temporary relief impacting coverage and planned administration. I want to put just a little aside here. We could easily see another extension. These things can get extended out and extended out. As of now, though, we do think May 11th, 2023 will be the end of it, but keep that in the back of your mind that we may be dealing with something, another extension that takes us through the summer. So, assuming this third extension is it is the last extension. We are not extending these acts and these provisions beyond May 2023. What does this really mean for employers and health plans and those of us who help employers in the industry? So let's look at snapshot 1. So the COVID-19 preventative services regarding vaccine coverage mandates will continue to apply, but only on the in-network basis. So the out-of-network basis goes away in May. Additionally, cost-sharing requirements for COVID-19 testing, including over-the-counter tests and related services, we'll start seeing changes there where there may be cost-sharing requirements. We're still waiting on some guidance there to see what happens, but we will see a change there more than likely. Compliance snapshot number 2. Large employers will no longer be able to offer the telehealth services to employees who are not eligible for any other employer-sponsored group health plan without being subject to certain federal laws, so as the federal law guides us. So the telehealth services will go away for those that are not eligible for the group health plan. This does not include telehealth services for participants of a group health plan where the employer may have put some telehealth services in place. This is specifically for those employees that are not eligible for any other type of employer-sponsored group health plan. And then compliance snapshot 3. This goes more to the national emergency with the anticipated May 11th, 2023 expiration date. Also for the national emergency, the outbreak period is expected to end on July 10th, 2023. So for the national emergency, there were some provisions in there that we had to look 60 days beyond the end of the expiration of the national emergency. So we start there and then we count out 60 days, and that designates the end of what's called the outbreak period. So that takes us to summer, July 10th, 2023. And so a lot of the administrative deadlines we will no longer have extensions. We will no longer have grace on some of these, including, for example, requests for HIPAA special enrollment rights, electing and paying for COBRA coverage, submitting claims and appeals, employer deadlines to furnish certain required notices and disclosures under ERISA, such as the provision of SPDs or summary annual reports. And then, as we mentioned in the beginning as well, the filing of any benefit claims the appealing of any adverse benefit determinations, requesting external reviews, and any other types of external review requests. So let's look now at the impact on group health plans and employers. And this is specifically on group health plans and employers. Of course, that includes everyone that's on the call, anyone that's helping clients with either their plans, helping them with their operational or compliance responsibilities, oversight, administration. We kind of had to upset the apple cart at the beginning and put all these provisions in place, and now we're taking them all away. So it's a little bit of what are we left with? And we are starting to get a lot of client questions on this. There's still a lot of confusion around these laws. So first, let's look at coverage and plan administration. For each of these slides, we look at coverage and plan administration, group health plan impact, and then the employer action. So first, we have COVID-19 testing, which will include the over-the-counter tests that we have and any other related services coverage. So as of May 11th, 2023, plans will no longer be required to cover COVID-19 diagnostic testing and related services without cost sharing, prior authorization, or other medical management requirements. So what do employers need to do at this point? Actually, before May 11th would be preferable, but what do they need to do with this upcoming change? They need to start confirming with their insurers and their TPAs how COVID-19 diagnostic testing related services are going to be covered under the plan. How are the over-the-counter tests going to be covered? How are the COVID-19 vaccines going to change? When are they going to change? Is there going to be cost sharing for that? And then communicate, importantly for ERISA compliance, the communication of all of these changes to participants and their beneficiaries. Are we going to distribute summaries of material modification? Are we going to redo SPDs and send them out? From an HR standpoint, as we all know, a lot of times these notices don't provide any clarity for participants, even though they're required under the law. They're still a little bit too legalese. So how are we going to handle this from an HR perspective to help participants and their families know what is going to happen moving forward? For example, I know that I'm sure people have seen this. I've just started seeing a couple of commercials for if you haven't had a COVID-19 shot. I can't remember the date, but it was sometime in the fall of 2022. You should be getting another one now. So, these are the messages that people are going to be getting, and they're going to wonder, how is the plan going to cover this? Is the plan going to cover this? How is that going to work? COVID vaccines are probably going to become part of our lives, just like flu vaccinations. So we'll have to see. So we really need to focus on that communication to participants outside of the legal responsibilities that we have. Okay, coverage plan administration. So the vaccine coverage, so let's specifically talk about this. Again, as of the end of the period, May 11th, 2023, we're going to have preventative services coverage. Will continue to apply for COVID-19 vaccinations, but coverage will only be required on the in-network basis. So cost sharing may apply for anything received out of network. So again, we need to, the people that are helping the employers figure all this out and walk this path, we'll need to encourage them to confirm with their insurers, confirm with their TPAs, confirm with their, advisors, how coverage for COVID-19, including over-the-counter tests, is going to change and when, very similar to our action steps that we had on that first slide. And then I can't stress enough the communication of these changes to participants and beneficiaries beyond the required changes that we need, such as distributing SMMs or SPDs. Okay, third, so our deadline relief, and I have this broken down into a couple of slides here. So remember, for the deadline relief, that throws us 60 days after May 11th, 2023. So we're looking at July 10th, 2023. So this will be in stages. But a lot of the pre-COVID deadlines will resume their normal timeframes for administering the plan, such as COBRA elections and HIPAA special enrollment rights. Again, discussions with like the COBRA administrator, for example, to understand what COBRA administration changes there will be, if they can identify any individuals who may be impacted by the change, such as those who may currently be on COBRA, but more importantly, those who may be in the election period for COBRA. And then how communications to clients will be handled moving forward, especially for those who are in the election period of COBRA. This will include any changes on the COBRA notices the Department of Labor has samples of on their website. It will impact the timing of COBRA notices when they go out. So we're kind of going back to our old true and tried way of COBRA administration, but there is still going to be a lot of confusion on this. So we need to make sure that we're very clear with employers on how this is going to happen. Okay, deadline relief part 2. Again, as of July 10th, 2023, 60 days after the expiration of the national emergency. We also need to look at other deadlines like HIPAA and special enrollment rights. So we've had some changes there over the past 3 years. We'll need to go back and look at plan documents and SPDs and plan amendments. And those, we're going to have to go back and revise all of those, create additional amendments if it's not included in the language already, about going back to the pre-COVID days of how HIPAA special enrollment rights work, timeframes related to those rights, and then specifically communicate that this deadline relief no longer applies to plan participants. We may need SMMs, we may need revised SPDs, we may need amendments and resolutions to the plan. And then how are we going to communicate that deadline relief, that it's gone to plan participants? Again, look at the SMM, look at the SPD, and then look at other human resources opportunities to educate the participants on the new rules. And we're going to have quite a bit of time for question and answer because there's not enough content to totally fill up an hour. So plenty of time to ask questions and bat around some of these ideas. Okay, so standalone health. Let me move this down. So again, this is the telehealth service that was available for participants, not participants, but employees who are not eligible for any other employer-sponsored group health plan. This was just for large employers to allow this. So it's going to go away for these participants. It is effective when the plan year that began prior to May 11th, 2023 ends. So what does that mean? So for calendar year plan years, that means that this will go away and become effective on January 1st, 2024. So it's the plan year that begins prior to the May 11th, 2023 end. So it's going to push us out to the next plan year for calendar year plan years. Of course, we know in the health and welfare space, we have a lot of plans that are not on calendar year plan years. So we're going to have to do some math and calculation on that. Discuss with the carrier and review telehealth eligibility to ensure that telehealth services offered are compliant with the ACA and other federal requirements. Again, this is different than the continued telehealth and HSA relief that permits high deductible plans to provide free low-cost telehealth services prior to meeting the high deductible minimum deductible to preserve the HSA eligibility. This is different than other laws such as that impacting telehealth. This is again only for large employers and employees who are not eligible for any other employer. So I do see that we have some questions. Andrea, I'm not sure how you want to handle that since this is my first time doing this presentation for you all.
Jenny, this is Meg. I can go ahead and read those to you from the
Great.
Q&A. And then if anybody else has a question for Jenny, please go ahead and type it into the Q&A box. You should see that at the bottom of your Zoom screen. So the first question we received was, will most or all insurance plans automatically update and publish SBCs for their plans according to these changes?
Such a great question. And the answer is, I don't know. I'm trying to get away from the, it depends. It would be really nice if all providers went on and updated everything accordingly. Employers are going to have to do kind of some second set of eyes on their plan documents. Since employers are the fiduciaries on the plan, they ultimately have the responsibility to make sure that the documents are updated. So I would recommend, it needs to be on everyone's radar that these changes are coming about, and there need to be plan changes plus notices to participants, whether that's in a SMM or an SPD. We just need to follow up is what needs to happen. And we need to help our employers who are already fairly overwhelmed at this point to follow up. You're going to probably see some of the larger providers like, Blue Cross Blue Shield provide this information, and it will be hopefully, knock on wood, timely and compliant with these new rules. But some of the smaller providers, you may not see that. A lot of this also, we see this on the retirement plan side too, and we're actually dealing with some different COVID relief on the retirement plan side. Again, the larger providers, like on the retirement plan side, Fidelity, for example, is really good at going on and engaging employers and getting documents updated, getting notices to participants. But then again, we see a lot of smaller providers that just don't do it. Or the reason I'm making that comparison is because a lot of times you have to go in and you have to look at the vendor contract and see what the client signed up for. What did the employer sign up for? It could be that some of this is an extra service. Some of this the employer has to initiate. Some of this the employer has to opt into. And you typically see this for the smaller providers. So we need to kind of put it on all of our radar to follow up. Even on the larger providers, such as Blue Cross Blue Shield, if they go on and send everything out, I still recommend that it's reviewed by people knowledgeable in the industry. I have seen mistakes come down from some of the large providers. So we want to make sure that we're following up and making sure that everything is compliant. Again, we know the buck stops with the employer, so second, third set of eyes will not hurt.
Jenny, our next question we received, I saw at a recent conference that as long as the federal vaccine supply lasts, there will be no changes related to cost sharing. They stated that the plans cannot deny or charge anyone for a federally purchased vaccine. Are you familiar with this?
I am not, and that is fascinating. I am going to make myself a note.
And perhaps you could maybe in the follow-up Q&A.
Absolutely. I will email a follow-up on that because we do know as long as it's in service, not out of service, that it can be provided. based on what I have heard, I don't think we're going to run out of a national supply. In fact, I've heard, and you guys may have heard this as well, I've heard of some potential combination vaccines where you get your COVID and your flu all in one. But let me look at that and come back with some more information on that. That's a great question.
And we'll send you all of the questions and answers, and then to be able to send them out to all the participants.
Perfect.
The next question we received was, what date do you suggest in giving, I believe this would be giving notice to employees for getting their vaccine to be proactive of this coverage cost sharing ending?
Gosh, yeah, that's a good question too. May 11th is not that far away. So let's go back a couple slides to the vaccine. So again, this is, I kind of lump things in the benefits world and I'm saying this for a reason because I think this is where this question falls. There are legal things that are permitted that you can do or you're required to do as far as changing plan documentation and notices to participants. You all have seen a lot of those notices to participants, and I sometimes compare it to the credit card terms and conditions that we get. Most people don't sit down and read those notices. So we're required to give them legally. We are not required to make sure the participants read them. So from flipping then over from the legal to the HR side, which HR is typically dealing with both of these, we want to protect our employees and make sure they're getting the information they need. And I kind of feel like that's where this question falls. So I would say probably, it's middle of March already, probably within the next couple of weeks, somehow to get a notice out to participants, put a note on the intranet, on any company portals of saying if playing with that language there, but if you are getting COVID-19 vaccinations on an out-of-network basis, they may want to check the plan because this is going to be changing in May. And I think some bullet points there can be provided. That does not serve as your legal notice to the participants. Again, that would be the SMM or the SPD, but you can also say future guidance is coming as far as the plan. But I do think you would want to work with their in-house legal department or their ERISA attorney on crafting some language there, but giving people a heads up that this is coming. I think that's a great question. We really have a little bit less than 8 weeks until this takes place. So I think giving them, thinking about it all of May and all of April and into May to get a vaccine shot. It's not a lot of time, but I think that would be a good proactive way of dealing with this change with employees. Curious if anyone else has any comments on that. Or if anyone's seen anything else on that.
And we may give people an opportunity. If you have a comment you want to share, you could type that into the Q&A and I'll certainly share that with Jenny. We don't have a way to make everybody audible.
Sure.
While we're waiting for that, in case anybody wants to provide, you could also put that in the chat and I'll read that for everyone. We also did have another question that came in for people who are midway through an extension. What will happen to them?
Midway through an extension, which extension?
I'll have to wait for the clarification on that one. That one came from Andrea, but she did have another follow-up question.
Okay,
she did
great.
say, is there talk among the agencies to make any of these group health plan extensions and changes permanent?
Good question, Andrea. That I think goes to, oh, sorry, let me go back one slide. I think that goes to whether we're going to have another extension. It kind of falls in that bucket. It is very possible that we will get guidance from all of the agencies. It would be HHS, it would be CMS, would be IRS, it would potentially be Department of Labor as well, to get some guidance that changes are now permanent, or certain changes that we've implemented during the pandemic, that those are now permanent. I honestly think that that won't happen until we get closer to May 11th or after May 11th. I think they're going to want to see, do we need to extend again and push it out into June or push it out into July or August? If you guys remember, summer is supposed to be a good time for COVID because more people are spending time outside, so people aren't getting sick. So they may want to see how the summer impacts everyone. But I expect to get guidance on this from the agencies. I do not expect to get guidance in the next 8 weeks. We may not even get guidance for a while on this. It may not even be in 2023. But I do expect to get guidance on this, and some of this we may see as becoming permanent in our plans.
Thanks, Jenny. Another question, someone who is in their COBRA election period under the extension, how are those people dealt with?
Yes. So again, we don't have guidance on that. we tend to get the 30,000 foot law. And then we get guidance later. So let me go back to, here it is for COBRA. So we're going to have to, let me preface it this way. There should be some transitional guidance for those that are currently in their COBRA election period. The transitional guidance would more than likely say something to the effect of, if you entered the transitional period no later than or no earlier than X date, then you'll serve out your entire notice period. We have not gotten that guidance yet, so I am hoping we get some immediate emergency guidance on folks that are in the middle of, whether it's their COBRA or HIPAA special enrollment rights or those things that impact coverage. Hoping to get that sooner rather than later. Meg, one thing we can do is, this is clearly something we're going to be monitoring. When we see that we do have guidance on it, happy to shoot you an email so we can share with everyone that's on the presentation.
Certainly, that sounds fine. We also got another question. Will the vaccine mandate for healthcare workers end on May 11th if the public health emergency expires?
Will the vaccine coverage?
No, the question was, will the vaccine mandate for healthcare workers end on May 11th if the public health emergency ends?
I would think so, but that's separate guidance. So that is a good question too. I have not seen anything on that mandate yet.
Okay. And then Andrea did qualify that earlier question she had about, so the question was for people who are midway through an extension, and by extension she meant, this was kind of tied in with the previous question, an extension like COBRA notice, claims appeal extension, special enrollment notice. How are those changes handled?
Again, we're just waiting on guidance. I sound like a broken record saying that. But this is so common that we're all now like, okay, great. These are the new laws, or these are the new rules. How do we manage that? How do we administer that on a day-to-day basis? And we are waiting for the government to tell us. Now, sometimes what happens in the industry is you will start seeing some discussion about best practices. We think this is the best practice. We think this is the intent. of what the administration wanted. We think this is the intent of what Congress put forth in these changes during COVID. And you will start to see the industry as a whole take certain approaches while we're in this gap with no guidance. Not to keep bringing retirement into this, but we are seeing this exactly on the retirement plan side. We got some huge legislation released at the end of the year, and a lot of the changes are immediately applicable, and we have zero guidance. We have no idea how to implement them. And so we're seeing that here too. I do feel comfortable saying that any way we administer this, and this is just based on years of how the government works in this area and what ERISA specifically says, we aren't going to see any like cutbacks for these participants that are in the middle of these extensions, whether it be COBRA or HIPAA or even reporting requirements for the plan. You typically, well, I may preface that for the reporting requirements, but as far as the participants are impacted for like COBRA, HIPAA, things of that nature, and they're in the middle of those extensions, the government, I am 95% sure that the government will not implement guidance that truncates those periods for those participants that are kind of concern. The government doesn't like to have a cutback of any type of benefit. The government doesn't like to have any kind of cutback that's going to negatively impact participants. So I do feel confident that those participants will get to wait out those extended periods. And it may be for participants on or after this date. This is when the pre-COVID guidelines are going to go into effect. That is typically what happens with legislation and guidance from and rules coming down from the administration on this. So we'll have to see what the guidance says, but that's typically how it works.
Thanks, Jenny. I don't have any new questions unless someone has one last minute question here. I think that covers all the questions we've received.
Well, and one thing, Meg, that I will say that I will emphasize again is, let me just jot this down in the middle of an extension. I'll expand upon that when we get off the call. We're monitoring this as far as great, again, kind of like I previously said, great, these are the new rules. We understand that, we're kind of out of the pandemic portion of this. We're now, I guess, into the endemic portion of dealing with COVID on a regular basis. We're monitoring this. So as guidance comes out or as interpretations come out from whether it's the departments or whatnot, I will go on and send that information to Meg, to you and Andrea, so we can get that out to everyone who's attended the seminar as quickly as possible. Like I said, we have a very short time period. We only have a couple of months until this goes into play. So I'll send it as it comes out, just so we can be better prepared for our clients.
And I'm sure that we'd also recommend that everyone stay in touch with their UBA partner from broker. They'll be wanting to make sure that you have the latest information, and we'll get that information to you as soon as we receive it.
Exactly.
And I did have one last one here before we wrap up. It says, remind us how you said testing will be covered. It seems like it will be like any other diagnostic test.
Yes, and let's go back to a couple of these. So there's a little bit of a mix here. We've got that, just quickly looking at this again for the distinction. I believe that if it is in network, preventative coverage will continue to apply, but coverage will only be required on an in-network basis. Cost sharing may apply for out of network, but let me kind of wordsmith, dissect this a little bit typically in the law, I believe the way that the administration phrased this by saying will continue to apply, I believe that that is a mandatory, that it should be a covered service, but no cost sharing, only if it's in network. It doesn't seem like this is a discretionary provision that employers can choose.
And
Going-
Jenny, there was a
Yes.
clarification. I apologize for jumping in on you.
No, you're fine.
The questioner was asking more specifically about testing, not necessarily
Oh.
vaccination.
Got it.
Yep,
Thank you
thank you.
for that clarification. So any testing can still be offered. There's not a distinction, unlike the vaccines, between in-network and out-of-network, if I can say those words today, in-network and out-of-network. Plans are no longer required to cover testing without cost sharing, prior authorization, or any other type of medical management requirements. So what does that mean? The plan can include over-the-counter tests, but they may include a cost-sharing provision. So, and they also may include different coverage provisions. Maybe you're only allowed to get tests at an in-network pharmacy and not an out-of-network pharmacy, or, so we are going to see some changes there. Whether diagnostic testing has to be covered, I don't believe it has to be covered. The thing that the administration was trying to kind of drill in here is that it doesn't have to be covered free of any cost sharing. So employers can implement cost sharing, prior authorization, and other restrictions there. I don't know if that made things clearer or if that made things more complicated.
Thanks, Jenny. I'm sure, like you said earlier, a lot of is still up in the air. At least this is
It
initial.
is.
Yes. And
we're trying to parse like some of the words. For example, I mean, literally in contract drafting, you learn will and shall is typically mandatory, may is discretionary. We're literally looking at the words that way of, so the way I read this is plans will no longer be required to cover testing without cost sharing. That doesn't necessarily mean that they no longer have to provide testing services in the plan, or they do have to provide testing services in the plan. So I imagine we will see that. Truthfully, in practice, because I think COVID testing and whatnot is going to become as commonplace more than likely as like a flu testing. I think it's going to be a similar thing of like a flu test, whether that's covered or not. But we do have to wait for more guidance on that.
thanks, Jenny. We don't have any other questions, so I'll turn it back over to Andrea for our closeout. And perhaps if you can advance to that slide
I will.
showing our upcoming webinars, that would be great.
Here you go, Andrea.
Thank you. Thank you, Jenny, for that very informative presentation. And we look forward to hearing more from Fisher Phillips, perhaps through a follow-up advisor. And of course, we'll get all the answers to those questions as well. Our next webinar will be on April 11th, when the topic will be benefit considerations during layoffs, mergers, and acquisitions. Thank you to all UBA partner firms and their clients who joined us today. Fisher Phillips is a valued UBA alliance and authors UBA compliance advisors and the quarterly UBA benefits and employment briefing newsletter. UBA partner firms and their clients are offered preferred pricing for Fisher Phillips services. To learn more, contact your UBA partner firm broker or email ubamember@fisherphillips.com.